Welcome to another episode of What Brings You In Today.
I'm Erica Bennett.
And I'm Taylor Fisher.
And we just want to thank all of our listeners for your support and your interest in the What Brings You In Today podcast. And if you haven't already, please like and subscribe so you can make sure you're aware of all of our latest episodes.
And if you have any suggestions for topics or questions you'd like us to answer, you can submit those at sgmc.org/podcast.
So today we're here with Wendy Vandemark, who's a psychiatrist with SGMC Health. So Dr. Vandemark, what brings you in today?
Well, thanks for having me. Today I'd like to talk about mental health and just general wellness and what I like to call brain health.
Nice. Tell us a little bit about yourself and how you got into psychiatry first.
Okay.
A little bit about your background.
So I'm originally from Ohio. I went to University of Akron and did a combined Bachelor of Science medical degree program. And that's where I met my husband, Sean, who's a plastic surgeon here at SGMC. We did our training in Detroit and finished that up and worked up there I worked up there for a year or two. And then we have been down here in Valdosta since 2006 when South Georgia Medical Center recruited us at the time. And so what got me into psychiatry and mental health was, I went into medical school, kind of like most medical students, I think, where I just had a vague sense of wanting to be a physician in general and help people. I kind of envisioned myself as more of like a primary care doctor or maybe a pediatrician or OBGYN. But then I hit my first year of medical school and I experienced the worst anxiety of my life. I went through a really tough time. The anxiety was pretty crippling. It affected my sleep, my appetite, my ability to function, my ability to socialize. And I didn't really reach out for help because I was embarrassed and I, saw it as a personal weakness for myself. So I just kind of struggled through it and made it through somehow, but it was rough. And so, when I got to my third year rotations, it just meant so much more to me when I did the psychiatry part because I just felt like I could really relate to the patients and understand how much their mental health was affecting everything. And, it felt a little more personal to me at that time. And then I did a second rotation as a fourth year, and one of the physicians there really kind of took me under his wing and kind of mentored me and felt like, that it could be a good fit for me. And I'm so glad he did because he really encouraged me to go through with psychiatry and actually pick their residency program there at Henry Ford in Detroit. And that was just the right thing for me to do at the time. So, So looking back, I think it's the, I'm so glad that it worked out the way that it did because I'm more of a quiet, kind of introspective kind of person. I'm more of a listener than a talker. I don't know. May not seem that way right now, but but I am, and so it's just a good natural fit for me because sometimes being quiet and quote unquote shy is it's not helpful, but in this field I can lean into it, and it's actually a great strength. So
I know we didn't have a lot of time to talk before we started recording about our personal passions and stuff, but Taylor and myself are very passionate about mental health awareness and making sure that people are getting appropriate help when they need it, recognizing that the pressures that are put on just individuals in general, especially women, I feel like, is immense. And we shouldn't have to suffer alone or think that there's something personally wrong with anybody for struggling. And then how do you ask for help? So I guess what is something that you tell patients or just individuals when they're maybe hesitant about reaching out for help or to a professional about kind of what are the first signs that you might need to speak to someone, I guess?
Yeah, I just like to say, that we are just another medical specialty. It's like, going to a rheumatologist or an endocrinologist, we're just another field of medicine. So just come on in, and it's not ever nearly as scary as anyone thinks it is. It's just very conversational, very relaxed. We're not here to judge anyone. We're just here to, to help and to listen. And, you don't have to wait until you're really, really feeling terrible to come in. Like you wouldn't. If you had mild asthma, you would still go seek help. You wouldn't wait till you had to go to the ER. So it's the same thing with mental health. You don't have to wait until you're, incapacitated to come in. We treat all ranges of mental health issues. So I would just say, come on in. We're not going to slap a label on you or, insist on lifelong medication or a lifetime commitment. You might come in and we don't need to prescribe medication at all. There are lots of different things that we do, in mental health. It's not all about prescriptions, right. Although we do that too.
Yeah.
And I think some of that is the stigma that we've seen for many years around mental health. But I think that luckily that is starting to change in the world, where it's becoming, way more common for someone to talk about their mental health publicly and seek help. I mean, like Erica said, I'm very passionate about it, so I have no problem talking about going to my therapist or, this or that. So I think, people talking about it more is kind of helping people to feel more comfortable going that direction, don't you think?
Absolutely. And just normalizing it and realizing that getting help is strength, that it's not a weakness, that shows a sign of strength. And it's definitely getting better, but there's still some subsets of the population that, still it still lingers out there. 1 in 5 people suffer from mental health, but less than 50% come in for treatment. And so, it's still, in certain, the Black and Hispanic community, it's less than 40%. And I saw a statistic that in Asian Americans, it's less than 8% will come in. So we still have some work to do there, but it's definitely getting better. Yeah.
I know we just completed our community health needs assessment for Lowndes County, and one of the major identified issues was mental health. So it is like people, I don't know if it's, and that's something new to our report. We do it every 3 years, and that hasn't always been like up there as like a top 5 thing. So I don't know if it's people are more aware of it too, so they're more like readily identifying that, or maybe like a younger generation completing, the survey, so they are more familiar with it, so it's more top of mind. It's just interesting that that's out there.
Mm-hmm.
I was curious when I saw that survey go out how that would turn up, and that doesn't surprise me that was a huge need identified.
Are you seeing a big difference just in trends, I guess, since COVID? I mean, I would expect that people's mental health after that event, just because it was so traumatic for everyone, no one kind of escaped that epidemic. But are you seeing like a rise in people seeking help? Not necessarily because of COVID-19, but I'm just saying in general afterwards, just from the stress of that entire situation across.
Definitely. Yeah. And, for a myriad of reasons, the mental health issues increased over 25% after the year after the pandemic. And then in the last decade, youth suicides have gone way up. They just did a survey and less than 50% of college students feel some type of issue with their mental health. And that's all been post-COVID. So, fortunately, in some ways, the telehealth during that time, was a real benefit, and it did increase the possibility for people in some rural communities to get help, but that didn't really help with the amount of providers that we have,
right,
which is still, a critical need. So the usage and utilization and the need is going up, but the amount of psychiatrists and providers is going down. So that's where that mental health crisis is coming into play a little bit.
Talking about providers, so you are at SGMC Psychiatry, And can you tell us a little bit about your practice and who all works there with you and how you all work together to help patients?
Yeah, so we're so excited. We joined SGMC, our practice in June of this year, and so now we're SGMC Psychiatry. And it's myself, and we have a child psychiatrist there, Dr. Robert Maydell, so he sees all ages, from 2 on up, and does a great job. And then we have Dr. Nitin Patel, and he's been in practice for a long time, and he has a huge following of his patients that he's accumulated. We have therapists there, so we've got 3 therapists right now working with us, and we've been able, fortunately, to bring in several nurse practitioners, and that's been great because there is such a huge shortage of psychiatrists in general, that, you have to use a team approach. And so utilizing the help of our nurse practitioners and therapists has been great. But we just continue to grow, and there's more need for more therapists and providers. So,
Do you have to have a referral to go to your practice?
We do not.
Okay.
Yeah, we do
Just
not
curious if you
require
could
that.
self-refer.
Yeah, we can self-refer. So that, I think that's opened up some access to, to people that maybe were afraid to
The primary care doctor. I mean, a lot of people don't have a primary care doctor, and that's one of the things we try to encourage everyone to, start there and at least make sure everything's going on normal,
Exactly.
And then a lot of times they can help identify if they need the primary care provider and kind of give that extra push to see somebody professionally. I know that's what happened in my case. I finally bit the bullet. Is that the right phrase? But I finally got a primary care provider and started seeing her regularly. And then through our conversations, she's like, I think you would benefit from some therapy or seeing a psychiatrist. And that helped give me that little push.
Right.
And so, because it is hard to just cold turkey, I think, call up and be like, hey, okay, I think I need to see you.
Yeah.
It's very intimidating.
It can be, yeah. And so I do think the self-referral has really helped. So it's been funny because now doing that, we're actually, I find that I'm doing it the other way. So I'll be the first one seeing some of these people, and I'm like, I think you need a primary care doctor, so I'm going to refer you.
Works both ways.
Yeah.
Got to make sure you are physically well and mentally well. It's a...
Well, that's funny.
Mind, body, spirit.
Exactly.
So what would the role of, you have your therapist, your nurse practitioners, and then your psychiatrist. What are the different roles, and how do they all kind of play a part in the patient's journey, or would someone just see one person? How does that work?
So you can do it a lot of different ways. Most of my patients will see me for diagnosis and treatment planning and kind of collaborating and coming up with, what we need to do, the overall overarching plan and referrals, whatever we need to do in that area. And then in addition to that, and with the patients, we work hard on the medication side of things a lot of times, but not everyone needs medicine. And so they'll also have a therapist or a counselor that they meet with a little more regularly. Their visits are an hour at a time versus, with us medication providers, a follow-up is usually about 20 minutes. With your therapist, it'll be an hour, and you'll see them a little more frequently. So then the therapist and I are able to work together and share ideas, and the therapist can alert me as to any changes or anything I need to do medically, and vice versa. But some people come in and they want nothing to do with medicine, only want to talk to a therapist, and that is fine. And some people are the other way around. They're like, I don't have time for therapy. I don't like to talk, whatever. I would prefer just medication treatment, and we can do that too. Where the nurse practitioners come in is they do what I do. So they focus on the medication side of things. But that's not to say when you don't come in to see me or a nurse practitioner that we don't speak to you, because we definitely do a lot of counseling. And, a lot of times I feel like a coach and a detective and a MD all in one, so you're doing all the things. So it's definitely, a mix of all of that. But
Okay.
What's probably the most common thing that someone initially seeks, help for, goes to see a therapist or a psychiatrist for? I mean, I feel like anxiety is probably
anxiety is
prevalent.
way up there. Depression, sometimes grief will bring it on. Some event or happening in like a divorce or those kind of things. But we'll see a lot of like ADHD issues or people wondering, do I have autism? My child was just diagnosed, and maybe I've had it all along. Those kind of things. But I would say the majority. Or the biggest part of what we see is depression and anxiety.
So on that note, how do you know what's normal versus what's not? Like, what are some signs or symptoms that you might want to try to, 'cause I feel like people don't know that. So they're like, is this normal or is this probably too much? What do you kind of recommend or how do you handle that?
Yeah. So, everybody has mood swings. Everybody has anxiety and sadness at times. That's perfectly normal. But when it gets to the point where it's interfering with your functioning, when it's interfering with your ability to go to school or to work or interact with your family or, to be a person, to eat or sleep or, do all the things that you need to do to be a human, that's when it's starting to become a little an issue and something that we can probably start to help you with, so. And if you're on the fence, then, let us help you decide that. And sometimes it's reassuring to hear, nope, this is just, you're doing great. Just keep on going. Those are the kind of things.
And sometimes it's hard to tell, and it takes, I think, someone close to you to point it out, because it's hard for us to, introspectively notice, because I know I've dealt with anxiety my entire life, but, I didn't know that that's what it was because I didn't have a word for it until I got a little older and someone told me, I think that you have anxiety. I think that's, what's going on with you. And I was like, really? Because in my family, we didn't, talk about that kind of stuff. So then once you have a word for it and you start looking into it, you're like, oh, wow, that kind of just changes everything. So just kind of not necessarily diagnosing your friends and family, but, it is kind of helpful if you see someone you love struggling to kind of, hey, maybe you should talk to someone. Do you ever see that your patient's a family member is the one that encouraged them to come in?
Yeah, and that's a really good point, too. It's important to be introspective and notice things about yourself, but also, in your family, if you are seeing things that you're noticing or picking up on, it is a good thing to kind of point that out to them and maybe encourage family members to get help or get treatment to try to destigmatize that. But absolutely, sometimes we'll have people come in and they'll be just kind of rolling their eyes like, my wife wants me to be here, but I'm fine, and then I'll look over at the spouse and they'll have some very valid concerns. And so then when you really dig deeper, the patient's able to admit that, okay, yes, things aren't great, so it's really helpful if someone is fortunate enough to have support that cares enough to point things out like that and to even, come into the sessions and give us some perspective on things. And it works the other way too. Sometimes the patient will come in and say, you put me on this medicine, I'm no better at all. And their family will come in and be like, yeah, but you have been going to, the baseball games again. And you are coming out of your room more. And, so sometimes they see the positive changes sooner as well.
Yeah. Yeah, I've noticed that whenever I got diagnosed with ADHD and I felt like the medicine wasn't helping. But my husband was like, but I think it is, actually. Because I didn't feel like it was, and my doctor even told me, ask your husband, ask people around you if they notice a change in you, because they might notice it before you do.
Exactly. Yeah. That happens a lot.
Yeah.
So this is random, but have you seen that movie Inside Out?
Yes.
With having two small children, I've watched that one, Inside Out and Inside Out 2, and I just thought that was fascinating how they talked about all the emotions and gave them names, starting, at a young audience to start thinking about this and making it more, not such a bad thing. And like,
Yes.
I just thought that was so cool. And then talking about like core memories and things, that was really interesting to me how they
I know.
put that all
love that
together
movie.
in a movie.
I think that was
highly recommend
that was great. And I think, the more we talk about those kind of things, the easier it gets to talk about it. And, when you make your emotions or experiences more of a narrative, and can put words into it, then it kind of, takes some of the sting out of how you're feeling, and you're able to, articulate it and get help.
Yeah.
So.
I haven't seen the movie.
You have to
Oh,
you should
it's so
see it.
cute.
It's really good for even. I saw the second one first, and I was like, wow, okay, I need to go see the first. And then I went back and watched the first one. But I was fascinated from just the medical perspective, looking at it from an adult and how they visualized all the things, but they make it relative to children. I was like, that is so cool. Like
I
that.
love that. I know. I hope they come out with a third one.
Yeah, they probably will. I'm sure they will because, mental health's not going away. So there's all kinds of problems as that character evolves. But
Well, maybe I need to check it out.
yeah, you should watch it. You should watch it this weekend.
Are there any certain types of, new therapies or new modalities or anything that you're seeing kind of emerge that are making a difference for any of your patients other than just, we've talked about medication and talk therapy. What else is out there?
Well, yeah, there definitely is, and it's so exciting. It's one of the things I love about this field is it's ever changing and new ideas and treatments come out all the time. There are a lot of new medications out. I will say that, which is so wonderful. Even since I completed my training 20 years ago, our repertoire of options for medicines has just expanded, and they're so much safer now, and they're not addictive, and they don't, cause any long-term issues with your body. And so that's wonderful. Definitely have new, therapeutic techniques that have come out in terms of the way therapists can do therapy. There's EMDR therapy and different therapy that we do specifically to process trauma. There's also a whole field of psychedelic medication and treatment and assisted therapy that's coming out and emerging, and it's just fascinating. And it's like using things such as psilocybin and MDMA and some older, substances that we have had around and applying them in different ways. And ketamine treatment has gotten amazing, very rapid results for people. And then we have things like transcranial magnetic stimulation, which, all in the past that we had was electroconvulsive therapy, which sounds terrifying, but really isn't. But, it is a process. And transcranial magnetic stimulation is just an easier, more accessible type of treatment that we have for patients. So, yeah. And then biomarkers are coming out, and different scans that we can do. I think the big challenge is getting payers or insurance companies to reimburse for some of these things. But I think the more evidence that comes out, the more that will be available too. So,
Yeah, I've heard of some of those. I've done EMDR myself, and I found it extremely, extremely helpful.
Yes.
Like you said, for processing things, and you don't even realize that you're doing anything. It's not painful. It's not, anything scary. Just literally sitting and talking while the therapist does certain things.
Yes.
And then it totally makes a huge difference for you.
it does, and it works more quickly than some of the previous types of therapy that we had, like analysis, where it would go on for years. EMDR is much more rapid and I would say efficient and convenient. So it's exciting.
Yeah.
If you had one thing that you had to recommend, or that's like the easiest step someone can take to have be a little bit more healthy on their brain, what would that be? What would you recommend? I kind of feel like exercise is on there on one, but I'm curious just to what your
Absolutely.
answer is.
So I'm big about brain health because, the brain is basically the command center of the body, and you can't have health without brain health. And so the big things that go into that are absolutely exercise and things like, yoga and meditation, and just protecting your brain, not doing the other things that could be harmful, like using substances or cigarettes or, so just really protecting the brain, eating healthy, getting exercise, getting sleep, and also that social connectivity is really important, and that can be with pets or people or, but just that feeling of being connected. All of those things together. So you want to do those things before there's a crisis, right? So we want to do those things before.
That's probably not going to help you in the middle of a crisis,
right?
But you can start before that happens.
Exactly.
It's a proactive measure.
Definitely. And, and it's not everything works for everybody. Like, yes, I love yoga. It's one of my coping mechanisms and whatever, but that's not for everybody, So you really have to find what works for you. And sometimes it's just a mix of different things. But, I really try to emphasize that with my patients.
I totally agree. I mean, even just going for a walk.
Yes.
Not in the 90 whatever degree.
Right.
But going for a walk and just clearing your head. I also like yoga as well. And, spending time with my pets. I have 2 dogs.
Pets are the best.
So, I mean, those different small things do make a huge difference just to kind of decompress from your day because we are so busy all the time.
Yeah.
And life doesn't stop. I mean, like, stressors, they just come. They are constantly coming. Things are happening. Events are happening. Things that unexpected tragedy happens. It's out there. And I feel like now more than ever, we're probably seeing a lot more of it constantly because we're on the access we have through social media and just like seeing so many things. It could be easy to like kind of have overwhelm from that. So disconnecting from, I don't know if that's part of your thing. No. Disconnecting from social media and things like that can be driving a lot of issues.
I totally agree. I think, that has definitely played a part, especially for the, our younger folks in high school and, well, even younger, middle school, grade school, all those kind of things. So, yeah.
It's wild out there.
I know.
It's
tough.
It's just the constant access to everything on the internet, and even as an adult it's hard to have that all the time, the comparison. I talk a lot about that, comparing your bodies, your lifestyle, what you have to other people, and that just leads to so much misery. I think just the constant comparison.
And now with AI, when things are,
we didn't even talk about that.
Generated. You really
you
don't even know.
What to trust.
Yeah, exactly. Yeah. So, that's why we all need to just protect our brains.
Disconnect. Maybe say no to some things.
Yes.
I found that has been something that's become more important as I've gotten older, is saying no and not always saying yes to every single thing that's asked of your time, because you only have so much time and you have to protect it. So it's okay to say no sometimes. I can't do that right now because you need to rest or you need to prioritize your me time.
Absolutely. Yeah. I think that, that helps prevent burnout too. We've been talking a lot about physician burnout and burnout in general, but you have to have those boundaries to have any kind of meaningful career of any type of longevity. You have to take the time off. You have to put your phone away for a minute, and really disconnect sometimes so you can get that rest.
Yes.
Protect your energy.
Yes.
It's hard, though.
It is.
But it's important. And I do think that's another thing that's kind of just becoming more common. Like, people are aware of it. Like, okay, I only have so much I can give. Like, you cannot, and you just can't give from an empty well. So you have to, you got to refill yourself so that you
can't be reached 24/7. The phone's going to have to go on Do Not Disturb at some point.
Exactly. Yes.
That's okay.
And don't feel guilty about it. Yeah.
Well, I think we're coming to the end of our time. So do you have any final thoughts of encouragement or anything that you would like to say to anyone who's listening to this who is maybe a little wary about getting help or talking to someone?
Yeah, I would say, just come in. Just come in try it out. And like I said, it's a strength to get help, not a weakness. There's just so many great options out there that we can help people with. So make yourself a priority and take the time and, just take care of yourself and your brain.
It's kind of similar. That sounds similar to me from what I hear from when someone's like, well, how do I know if I'm having a heart attack or if I should go into the ER? Like, I don't want to embarrass myself and go in there and it be, gas or something. Well, you don't know. So you really should go get it fixed or looked at just to be on the safe side. And that's kind of what I'm hearing with the mental health, too. Yeah. If you kind of have an inkling that you might need to see someone, it wouldn't hurt to check it out. Yeah. So it's not going to hurt anything. Mm-hmm. Give it a go, and then most likely it'll probably help, I bet.
Yes. And our last question that we always end with, since our providers spend so much time here, is what is your favorite meal to eat here in our cafeteria or in our allspice?
So my husband spends even more time here than I do as a surgeon. So he has created the Vandemark wrap.
Oh, nice.
So it's his own concoction of a grilled chicken and a cheese. I can't even tell you, but that's what I usually order, and it's
so you don't even know what it's on it. You just tell them. They just know.
They just know. Yeah,
like,
yeah. He just walks up and just nods.
Yeah. And they're like,
they know I got you. Do. I don't know. I'm not to that level. But.
Okay. Well, if you want one of those, you can go ask for it. Maybe you'll find out what's on it. All right. Well, thank you so much for being here today, and I think this has been a really good episode.
Mm-hmm. Yeah, we appreciate you taking time to share with us.
And thank you to all of our listeners for tuning in today. And if you have any questions or topics you'd like to submit, you can do that at sgmc.org/podcast.